I will start a retrograde tunneling technique to inject the vermilion border, as we discussed before, in order to give her a little bit more eversion of the red of the lip and reinforcing the beautiful natural shape that she has. So I usually start with the medial part of the vermilion, pointing the needle tip towards the tip of the cupid arch in order to create the first little line of vermilion correction, and then I measure from my entry point back and take the second entry point just in that distance that the needle is long enough to create a little bit of an overlay, and I try to avoid double injection in the area that I had injected before. The Juvederm Volbella product is extremely easy to inject, so it does not require a strong pressure of my thumb, and by that it is providing an extremely subtle and fine-tuned correction modality for this subtle area. How does that feel? Perfect. The third injection is from the peak of the cupid arch, pointing downwards to the bottom in order to create a nice base of the philtrum and to evert the central part of the lip to restore a heart-shaped form in the center of the lip. Schmerzen sind okay, ne?
Mhm.
Geht das? Das Zentrum ist sehr empfindlich eigentlich. The lidocaine provided with the Juvederm Volbella makes this product, despite the fact that this is an extremely sensitive area, very comfortable for the patient. You could see that she was almost not even twinkling with her eye. She's perfectly relaxed, and when I asked her how she feels, she said she almost feels nothing. Again, going back from the center part where I want to end with my injection in the first line, I measure down the length of the needle. I choose my first injection point, just the distance of the needle laterally of that one, and I tunnel along the vermilion border, reaching with the tip of the needle the highest point of the cupid arch on that side, and I start slowly injecting by pulling the needle backwards, creating an eversion of the vermilion border and making the red of the lip, of the upper lip, a little bit more visible. That's what she wanted to achieve. We didn't want to change her natural lip shape. The lateral point, measuring back again, entering almost from the angle, tunneling and injecting by pulling backwards with constant, steady, slow extrusion force. It does not take any extrusion force, it's just a very slight pushing of the needle. The last injection point here, again the tip of the cupid's arch pointing downwards in order to create a definition of the philtrum, creating a base, and by that providing a heart-shaped center of her lip without over-correcting this part as well. Seeing her now, she has a very nice eversion of the vermilion border. It's a significant improvement of the heart shape in the middle of the lip without creating an unnatural look that she didn't have before. The treatment of the lower lip is very similar to the treatment of the upper lip, with the difference that we don't have a cupid's arch, obviously, in the lower lip. So we don't need to take care as carefully as in the upper lip about the architecture of the cupid's arch. I still do it in two portions. So I measure with my needle from the center part of the lip outward, and that's my first entry point of the needle. Okay. I tunnel and I slowly and steadily, with very, very low force, very little force, inject by retrograde, pulling the needle. And I am careful that I don't stop injecting too close to my entry point, because I want to avoid the product placement too superficially. I measure again from my first entry point outwards. That's where my second injection starts, and I tunnel anteriorly and I inject by pulling the needle backwards slowly and steadily, creating a vermilion definition in that part of the lower lip. Seeing her in profile again, see, by injecting the lower lip now, we have created a more natural balance if we compare the anterior projection of the upper compared to the lower lip, which avoids the over projection of the upper lip after treatment if we would have left the lower lip untreated. In order to accentuate the center of the lower lip a little bit, like we did in the upper lip with the cupid's arch, I add two last central injection points in the lower lip behind the muscle in perpendicular injection technique, in order to have, without adding additional volume to the lower lip, have a little bit of accentuation of the center of the lower lip that gives it a perfect aesthetic balance resembling the upper lip treatment. Zwei letzte Punkte. Geht's? Here I choose my entry point roughly half a centimeter below the vermilion border in the white part of the lip. I go perpendicularly through skin and muscle and place the little product droplet behind the muscle and take advantage of her dental arc, which helps me projecting the lower lip a little bit outward without adding additional volume to the lower lip. The second point I just do symmetrically on the other side. For each injection point, I'm using 0.1 cc of Juvederm or Voller. So looking at her now, she has regained more visibility of the red of the lips in the lower as well as in the upper lip. We have reconstructed the architecture of the cupid's arch and redefined the vermilion border in the upper and lower lip, and at the same time rebalanced the projection of the upper to the lower lip to a very natural balance, where the lower lip should exceed the projection, the anterior projection of the upper lip, by about 1 to 2 millimeters.